Hello everyone. As we all know that we are interacting for a 12-week certificate course in palliative care with integrative approach. And in the part 1, today I'm going to discuss about stress and burnout, part 2. Earlier, as we have discussed part 1, in which I have tried to make you understand what is the basic difference in stress and burnout. I think all of you have understood it. Today I will take a glimpse of that before we go into the further lecture. Further lecture is the coping and intervention strategies for stress and burnout. Burnout is a chronic condition of stress. Stress is an acute condition and burnout is a chronic condition. When stress persists for a long time, the patient enters into the burnout condition, which is very difficult to manage. So, coping and intervention strategies for self-care by the physicians. Mainly, you know that it is not only the patient, it is not only the family members of the patient who get stress or burnout. It is a doctor also who get stress and burnout because of the patient. So, it is very important that you are treating the patient, but side by side, you should take care of your health also. The doctor's health is very important. That should be taken care during the treatment in palliative care. So, this slide is a little clumsy. I want to tell you the biochemistry behind stress and burnout. I feel all of you will concentrate on the slide. These are the main hormones involved in stress and burnout. What are neurotransmitter changes? In stress condition, hormones, cortisol, primary stress hormone, and adrenaline and noradrenaline, fight or flight response. This is activated. In the burnout, cortisol, chronic dysregulation. Cortisol is hyperactive, but chronic stage has it. It is acute, it is chronic. So, decrease serotonin, dopamine, and endorphins. There is a decrease in these three happy hormones. Serotonin and dopamine are called happy hormones. Neurotransmitter changes. In stress, there is an increased glutamate, which is an excitatory neurotransmitter. Temporary increase in serotonin and dopamine. This is called the acute response. But in the burnout, decreased serotonin. There is a temporary increase. This is an adaptive step. But here, since adaptation has been overcome by chronic condition of the stress, so now there is a permanent decrease in dopamine and serotonin linked to depression and loss of motivation and pleasure. Dopamine has come down, serotonin has come down permanently. Imbalance in GABA, reduced calming effect. This is the three things which happen. Immune system. In the stress condition, acute stress boosts immune reactivity temporarily. If you are under stress, a immune system will be activated. But if you are in the burnout, chronic stress burnout suppresses the immune system functions, higher risk of infection, slow healing. If you have a wound, there is slow healing. If you have a chance of exposure to bacteria and virus, there is a higher chance of infection because your immune system has been compromised in the burnout cases. Now, inflammatory markers. Increased pro-inflammatory cytokines like IL-6, TNF-alpha, temporarily during acute stress. But in chronic burnout condition, persistent elevation of inflammatory markers, chronic low-grade. This is called the chronic low-grade inflammation. When there is systemic inflammation, all the vascular system is compromised. And if vascular system is compromised, there is always a chance of cardiovascular disease. Elasticity of blood vessels decrease, vasodilation capability decreases, there is a chance of hypertension. Similarly, calcification may appear, with the hardening of the blood vessel may take place. These are the side effects of burnout condition. So, try to understand the inflammatory markers, TNF-alpha, IL-6 are permanently high, and there is a C-reactive protein or HSCRP, high sensitive C-reactive protein, is permanently high, which is damaging your cardiovascular system. Now, metabolic effects, increased blood glucose, that is a gluconeogenesis, means glucose is formed in the liver from non-carbohydrate substrates. Always glucose is coming out. You are not eating, but even then liver is producing glucose. So your blood sugar will be high. There will be chance of glucose resistance, insulin resistance. There will be chance of diabetes. So what is happening? We increase the lipid breakdown and increase the blood glucose. Both are high. So this both will lead to insulin resistance. Insulin resistance is a pre-diabetic condition. You will, what you call pre-diabetic condition means your blood sugar will be high or insulin will be high, but insulin will not be effective. What is the cause? What is the purpose of insulin? Main function of insulin is to transport the glucose from blood into the tissue. It is only active when insulin receptors are sensitive. Now the insulin receptors are desensitized. So insulin is not acting on that. Suppose the gate is closed of your room, the gate is closed. How you can enter? So similarly, the insulin receptors are blocked. Insulin is not able to open the gate. So glucose is not going into the tissue. It is flowing in the blood, and that is the symptom of diabetes. So this is the condition in insulin resistance. And metabolic syndrome like obesity, diabetes, and hypertension. All the three things will happen. They are the components of the metabolic syndrome. Nervous system effect. Sympathetic nervous system activation is under stress. Fight or flight. Lado ya bhago. But here, in this condition, dysregulation of hypothalamus pituitary adrenal HPA axis, dysregulation. So what will happen? Because of this, all the controlling hormones like the ACTH, thyroid stimulating hormones which are produced from the pituitary gland, they are imbalanced. If they are imbalanced, all the other endocrine glands function will also get imbalanced. So this is the very important, because this is a sympathetic nervous system, and here hypothalamus pituitary adrenal axis is disturbed, and brain structural changes, short-term heightened fear center activation. Fear center in your brain is activated, short-term stress. But here long-term hippocampal atrophy, memory loss, prefrontal cortex dysfunction, poor decision making. You see, this is the cognitive behavior. Because of the burnout, you are losing your cognitive behavior, which is a permanent damage to your lifestyle. Brain structural changes, short term, this is long term. And oxidative stress, all of you know, increased production of reactive oxygen species during acute stress. But in the chronic stress, oxidative stress leads to neural damage, aging, and fatigue. They are the permanent changes, premature aging, feeling of fatigue, loss of energy, and neuronal damage may appear, which is a permanent damage. So the oxidative stress is no way good for your health. So and all the time we try to use antioxidant to control the free radicals, to control the oxidative stress. Similarly, lastly, hormonal dysregulation. Cortisol returns to baseline after stressor removed. If it is acute stage, stress is removed, cortisol will come to normal. But in the burnout stage, flattened cortisol curve, no proper morning peak, continuous low, high cortisol level. You know what happens in normally cortisol level increases in the morning, so that you get up, you start doing exercise and daily activities, going to bathroom and everything activity is done. It is because the cortisol circadian rhythm in morning it is automatically high, but daytime it comes down. But somehow if it remains high, this is not good for your health. So this is the thing which is happening in the burnout. Now, what are the coping strategies? Effective coping mechanism, integrating regular self-care, seeking support, and involving in various activities with mindfulness. This is the baseline method how you will cope with the burnout or stress condition. Integrate regular self-care. You should be focusing on mindfulness in all activities which you are doing in the whole day. Either you are working, or you are sleeping, or you are eating, or you are laughing even. Mindfulness means presence. Your mind should present in your action. This is called mindfulness in your activity. So, psychotherapy for stress. Mindfulness is one aspect. Now I'm going to psychotherapy. Cognitive behavioral therapy, CBT, intensifies and modifies negative thoughts pattern, enhances coping mechanism. Counseling provides emotional support, stress management strategies and guidance. Counseling, the CB, the psychotherapy for stress burnout, and mindfulness and meditation improves emotional regulation, reduces stress via present moment awareness. Mindfulness, I told you in the previous slide, what is mindfulness? It improves the emotional regulation. It reduces the stress via present moment awareness. You are living in present. And biofeedback is another important tool. Use physiological feedback to control stress response like heart rate and muscle tension. So there are 4 methods of psychotherapy for stress burnout. What is the importance of self-care by the physician? Now I am focusing on the physician who is treating the patient. Doctors often neglect their well-being. I mean, patient always keep on pushing the doctor. Look, my patient is this. Look, my patient is this. They should also feel he is also a human being. You should not push the doctor all the time, 24 hours. No, this is not good habit. He will also get burnout. And then self-care by the physician includes exercise and relaxation technique. The physician should be involved in regular exercise and relaxation technique. Time out and more sleep and rest. And social support and humor. He should also be happy. He should meet with people and get socially connected. And meditation and spending time in nature. This is the time you have to give to your physician while he is treating your patient. One has to be very careful. Second thing, yogic practices for stress and burnout treatment. This will apply to both. It will apply to physician, it will apply to the patient. So, yoga nidra resets the button for brain and body trapped in burnout. It is safe, cost-effective, and highly accessible. Everybody can go in the YouTube. A lot of yoga nidra videos are available. One can go through it. I'm just explaining how it explains it. How yoga nidra helps nervous system regulation, activates the parasympathetic nervous system, rest and digest. That is the vagus nerve stimulation. This is called. It balances the overactive sympathetic nervous system. Sympathetic nervous system is responsible for cortisol increase, and parasympathetic nervous system is responsible for vagus nerve stimulation, which is responsible for rest and digest. And this dominates during stress and burnout. So, nervous system regulation is done by nidra, yoga nidra. Cortisol reduction. Studies show yoga nidra can lower the cortisol level, helping to reverse the HPA, hypothalamus pituitary axis, dysregulation found in chronic stress and burnout. This is very important. And neurotransmitter balance. Yoga nidra promotes serotonin and dopamine balance, improving mood and motivation and emotional resilience. Improved sleep quality deeply relaxes and mind and body, helping to address sleep disturbance, which are very common in burnout. In burnout patients, there is a sleep disturbance. Nowadays, many watch have come, many digital applications are there. You can control the quality of your sleep, and you can see there are 4 stages of sleep: S1, S2, like this, deep sleep, and REM and non-REM cycle. Everything is disturbed. So the sleep quality is important. If you're in the bed, but the quality of sleep is not good, your mind is not relaxing. So yoga nidra helps in restoring the sleep quality, deeply relaxes the mind and body. Emotional healing. Yoga nidra helps in releasing the subconscious emotional stress. Something is in your mind you are not able to express in your friends, in your society, in your family. This subconscious emotional distress comes out by yoga nidra. And unresolved conflict that often contribute to chronic burnout. Next, cognitive recovery. Earlier slide I showed you there is a loss of cognitive behavior by burnout. But here, if you are doing Yoga Nidra, is a recovery, cognitive recovery maybe will come. Enhance prefrontal cortex function, improve decision making, focus, and memory, which are usually impaired in burnout. Cognitive behavior will improve. Oxidative stress will be reduced. And ultimately, energy restoration. Yoga Nidra can feel like hours of deep sleep in just 20 to 30 minutes, restoring mental and physical activity. If you are in the Yoga Nidra, even the short nap will help your mind-body balance like anything. This is the take away message of this slide. So now, another important aspect of yoga, that is I have told you there are 8 branches of yoga: yam, niyam, asana, pranayam, pratyahar, dharan, dhyan, samadhi. But yam and niyam, people usually neglect it. This is very important for your cognitive behavior. Yam and niyam. Yam means ahimsa, non-violence, truthfulness, cleanliness, contentment, and discipline. This helps you in managing the stress. It encourages the calm and stress-free mind. Satya helps in reducing mental conflict. And Suchita, purify in thoughts and environment, promotes the peace. The contentment fosters a positive and stress-resistant mindset. Content means whatever you have, you are happy with that. You are not in the rat race that I should get this, I should get that. You are not in that. And disciplined life, tap, self-discipline leads to resilience against stress. So all these yam factors are very important for improving your cognitive behavior and stress burnout. Further, meditation, asana and pranayama. This is also helpful. How meditation helps? Reduces the stress, enhances focus and emotional balance. And Shava asana, bhujangasana, anulom bilom. These are the methods which balances your nervous system. Now I am coming to the Ayurvedic treatment for stress and burnout. There are different methods described in Ayurveda, which is very much helpful in making your body detox and bringing your mind-body balance. If this is under coordination, then only you can come out of stress or out of the burnout. Most important is the Panchakarma therapy. What is Panchakarma? Detoxification and rejuvenation. There are 5 methods of Panchakarma. Snehan, Vaman, Virechan, Basti, Nas and Rakta Mokshan. 5 steps. Panch means 5 karma methods. But before that, there is another thing, Abhyanga, oil massage. This is called Purva Karma. Oil massage reduces the stress and improves the circulation, blood circulation in your body. And Shirodhara, pouring warm oil on the forehead to calm the mind. This is kind of forced meditation. Meditation you can do by yourself. Just get all your sense organs inside your body. The introvert personality, introvert condition, and that will have a meditation. But if you are not able to do, Shirodhara helps you in attaining that meditation stage. And Nasa therapy, herbal oil application to clear mental fog and stress. 1 drop of oil in your nose is very effective, and different kind of medicated oils are available. If nothing is there, sesame oil or mustard oil can also help in improving the mental clarity. And meditation and pranayama improves mental clarity and reduces anxiety. Anxiety is the main issue when your brain is overactive. That has to be managed by all these methods as anxiety is managed. So now some medicinal plants are there described in Ayurveda, and this is a group of medicinal plants called Medhya Rasayana. There are 10 medicinal plants, and I have described few of them: Ashwagandha, Brahmi, Sankpushpi, Jatamansi, Tulsi. Besides this, Giloy is also there, Manduparni is there, There are 10 medicinal plants. But these major rasayanas are very effective in fighting with stress and burnout. They are having some phytochemicals in them which acts on different receptors. They regulate the hormones and their action. That's why the therapeutic response of this medicinal plant takes place in your body. So ashwagandha reduces the cortisol and enhances the resilience. Brahmi improves the memory and cognitive function. Sankhapushpi reduces anxiety and promotes relaxation. Jatamansi acts as a natural antidepressant. And Tulsi is an adaptogen that helps body manage stress. So these are some of the examples. If you connect your patient to an Ayurvedic doctor, he will give you many more medicinal plants which can be used. There are 5 methods of using medicinal plant. It can be used as a swaras, it can be used as a chutney, it can be used as a decoction, it can be used as a pills, or it can be used as a avle. So there are 5 preparations from one plant. There are 5 formulations can be made. Depending on the palatability of the patient, the Vaidya recommends. Depending on the digestive power of the patient, the Vaidya recommends which formulation of the same plant will be more effective for your patient. This is important to know. And this is a talent or knowledge lies with the Ayurvedic doctor. So as a palliative caregiver, if you find your patient is in the stress of burnout, you should connect him to the Ayurvedic doctor and he will take the proper decision. Food habits, managing stress and burnout. In whole grain, nuts, seeds for steady energy. These things are only possible if the digestive system of your patient is optimum. If this is compromised, you have to think whole grain should be given or not, because it is not digestible. The patient, depending on the patient to patient, we have to take care. Consume fresh fruits and vegetables for essential vitamins. Herbal teas, tulsi, chamomile, to calm the nervous system. Tulsi tea is very important. Avoid caffeine, sugar, and processed, because these things activate your blood cortisol. This is already high under stress. So don't add more cortisol by drinking caffeine drinks. Try to avoid it. And hydration with warm herbal infused water. Herbal infused water means some medicinal plants infusion can be given for your hydration process. Not only drinking the warm water, but warm water with medicinal infusion will be more effective. So now I have told you there are 3 pillars of good health: ahar, nidra, and brahmacharya. If you want to make your patient healthy, then you should focus on the diet, you should focus on the sleep quality, and you should focus on the daily life routine of your patient. How you can focus? Lifestyle change. I have already discussed food, I have already discussed sleep quality. Now I am discussing the brahmacharya. Brahmacharya means lifestyle changes. Follow a daily routine, dincharya, to maintain the balance. What is dincharya? When you should have a routine, when to get up, when to sleep, when to eat, when to walk. Everything should be regularized in a proper manner. And engage in a regular exercise like yoga and walking. Depending on your stamina, capability, likeness, you should opt for yoga. What kind of yoga, how much time you want to invest, you have to depend. It will depend on the patient to patient and walking. Maintain a work-life balance. Work-life balance and practice self-care. Develop a consistent sleep routine for proper rest. Spend time in nature and practice mindfulness. Time in nature, mindfulness. So these are the lifestyle changes. More important, institutional support is also important. Family is an institution, society is an institution, friends and relatives. All these people support to bring out a patient under stress or burnout. So you have to reframe this relationship of your patient with these institutions. The resource available: access to counseling, workshop, and stress management resources. Mentorship program. These programs connect them with experienced professionals to guide and support them. Wellness initiative. Institutions promote health through activity like yoga, meditation, and stress awareness campaign. So these are the important things. Now, stress reduction strategies for a physician: reframing and modifying belief, number one. Thought stopping and realistic expectation, number two. Action strategy, you have to plan. Physical change and assertiveness, time management and problem solving. Leaving the situation, if situation is not favorable, leave it. And thinking strategies. These are the facts which if you follow, then you can manage your stress or burnout condition. So adaptive coping mechanism, learning and applying principles of stress management. I have already discussed in the earlier slide. You have to apply them for stress management. Participating in the support group. Support group, I showed you, family members, friends, all these you have to participate. And seeking appropriate therapy, yoga therapy, diet therapy, medicine therapy, everything. So conclusion, work less, number one. Summary and actionable steps. Recognize stress and burnout early leads to protective management. Institutions should prioritize mental health, resources, and support system. This is the take-home message of this class. The take-home message: stress and burnout may happen to patient, family member, caregiver, or doctors themselves. So, care for all the members of palliative care is important. Don't forget it. All the members of the committee, palliative care team should have a comfortable action plan, no stress, and no component of the team should be neglected. This is the important thing. So, discussion forum, I have made some questions. I will just read it for you to imagine. Imagine you are a part of the multidisciplinary palliative care team at a hospital. Over the past few months, you notice rising emotional exhaustion, not just among the patient and their families, but also among the doctors, nurses, and caregivers. The elderly patient often show signs of hopelessness, while the caregiver dealing with long hours and emotional strain starts experiencing symptoms of burnout. Meanwhile, the institution has limited resources for mental health support and financial stress on family members. As a team, palliative care team, you are asked with developing a sustainable plan to manage stress and burnout of all levels: patient, family, and healthcare provider. Questions are there. Objective: design a real-world strategy that are holistic, feasible, and adaptable for institutions with limited resources. Key reminder: in palliative care, compassion for others start with compassion for ourselves. It's a very important line. Action: please share your thoughts, practical ideas, or real-world examples you have seen work. So, brain is storming questions on that thought. How can early psychological interventions and personality-based coping strategies prevent patient burnout? What mind-body intervention could be offered affordably? Affordability is very important. Support for family caregiver. How can emotional and financial support be strengthened for the families? What community or NGO collaboration might help? This is a question. Healthcare providers' well-being. What self-care routines should be encouraged among doctors and nurses? How can we spot and address early signs of burnout in healthcare provider, doctors and nurses? Institutional action. How should palliative care institutions prioritize mental health support within limited budget? Budget is very important. Remember, budget is limited. In that budget, how can you plan? Can we integrate low-cost traditional methods like yoga, Ayurveda, and mindfulness, like Yoga Nidra and all? They're not very expensive. And innovation and ethics. How can technologies help in managing burnout? How do we ensure compassion remains at the heart of all interventions? So these are some questions I have given you. You have to write the answer in the Google Classroom for which the link has been given in the end of the class. And in the end, some MCQs I have made for you. The answer is also given, but without looking to the answer, try to answer all these MCQs. If you cannot, then take help in the answer. With these words, I end my talk. Thank you very much for your patient listening.